Okay, I'm Dr. Castanet. Now I'm going to demonstrate the lumbar Medix extension tool. This is for people with chronic back pain for whom strengthening the back will benefit them. It's not everybody. In fact, I wouldn't put people on here with significant symptomatic herniated discs that are causing sciatica. We also, as a precaution for anybody, we limit the range of motion and flexion, and we don't have them bend over too far, in other words, because what I try to tell patients during the course of their treatment, in terms of the low back, the things you really always have to be mindful of are bending and sitting. Those are the two most demanding biomechanical tasks that the back has imposed upon it on a regular basis, and that's what wears backs out. Spines like a neutral posture, meaning a posture like this, where they're not bending in any plane, they're just neutral. Not bending forward, not bending sideways, not twisting in any direction. They like a neutral posture. To the extent you deviate from a neutral posture in the neck or the back, you put greater and greater demands upon it. That means that the hardest things to do are bending forward repeatedly, or bending over far, or bending over and staying bent over for a long duration. The other thing I should note is that when we sit, it may not be apparent that we're bending because we're not bending from above down, but in fact we're bending from below up. So sitting and flexing your hip in order to sit does affect and influence the low back so that it is bent. That's demanding on the back, and that's why sitting is so often uncomfortable for people with back pain. There are a subset of patients that have narrowing or stenosis that typically get relief by sitting. That's a different issue. And but as a general rule, biomechanically what's most demanding on the back is bending and sitting, and that's what you want to be particularly mindful of as you try to baby or take care of your back when you've had an injury. And then after you recover from it, you want to be mindful that you have to interrupt those demands because they're tough. In other words, if you sit, you don't want to sit for too long. You're going to need to get up, assume a neutral posture, maybe even reverse it and do some extensions briefly. And if you're bending, you want to be careful about how far you bend, how long you stay bent over, and how many repetitions of bending you do. The other thing that is a good idea as a precaution when you do physical demands on the back is to hold your breath. Holding your breath contracts the core muscles, compresses the air in your abdomen. That stabilizes your spine and essentially acts as if you had a corset on. So you don't hold your breath, for long durations, but you hold it intermittently during the peak demands you're placing on your back by virtue of or by way of the physical activities and postures, things like that. In any case, let's get back to this for a moment. This is the Medix lumbar extension machine. Marianne is doing repetitions in it, extending backwards, lifting resistance. We've limited the range to what's comfortable for her, and sometimes less than that, as I told you as a precaution. We're also giving her a certain amount of resistance to strengthen her back and improve endurance in her back, but without making it uncomfortable for her or exceeding her abilities. Generally, over time, the strength will get better, and as people's strength gets better and they move and rehabilitate atrophied or weakened tissues, their pain becomes less and their function becomes more. So that's the Medix lumbar extension machine. How many repetitions have you done? Maybe 30, 40, 50, something since I've started flapping my gums? Okay, well that's it for the Medix lumbar extension machine.